telling the New York Times, quote, "I thought it would stop both engines. The plane would start to head towards a crash, and I would wake up." Now, he's waking up in jail this morning. It has a long road ahead of him with this criminal prosecution. I want to bring in some expert guests now to talk about what he's saying about what caused his behavior. I am so pleased to welcome back on the show forensic psychiatrist and body language expert, Dr. Carole Lieberman. Good morning to you both. Dr. Carole Lieberman, you hear this. What do you think when you hear his explanation?
Well, first of all, what he's describing are typical symptoms that one can have on psychedelic drugs. But, and his trauma, he was saying he was there with friends honoring a friend of his, best friend, who died in 2018. And he wears ashes around his neck in a necklace. So this is really the biggest trauma of his life, losing this friend. Now his attorneys are coming up with all kinds of reasons, excuses, saying that he was having a nervous breakdown, he was having a panic attack. They have a whole laundry list of psychiatric problems, a dreamlike state, anxiety, depression, stress, fatigue, dehydration. They're throwing everything in there but the kitchen sink. One thing that is really a problem is that the airlines, and your other guests can speak to this as well, but as a psychiatrist and as an expert witness, I have had cases like this where pilots are afraid to go for therapy. Whatever the problem is, anxiety, depression, whatever their psychological issues are, because then they're afraid that they're not going to be allowed to fly. There have been difficult or stringent restrictions about certain medications that they can and can't be taking and things like that.
I'm so glad you brought that up. Dr. Carole was going to mention this. So apparently, after speaking with his therapist about possible depression, Emerson is claiming, and I'm directly quoting here from the article, quote, "She's the first one who said, I can't diagnose you, but would you ever consider seeing a doctor who could diagnose you and possibly get on an antidepressant?" Mr. Emerson told the Times, and he did some research and learned that taking any medication would most likely ground him from flying for a prolonged period of time. Dr. Carole, this is exactly what you were saying. The avoidance of the proper care, perhaps a necessary medication, maybe, who knows, all to just stay up in the sky. Dr. Carole, what do you think after hearing that?
Yes. They're caught between a rock and a hard place because, they can't get help for fear of, first of all, if they lie about it and they're found out, they're in really big trouble. And so, but if they do get it, now supposedly they've been relaxing some restrictions in terms of some antidepressants that are allowed. But I had cases where of pilots who were in this kind of pickle and they couldn't, they wanted to continue to fly, as this man did. He's been wanting to fly since he was a little boy. So it's very difficult. But, the other side of this is there have been cases where pilots have been suicidal and they have crashed planes. So that is what the FAA is thinking of, too.
Oh, and that's just, it's a horrific thought, but a very real possibility if we aren't taking care of our mental health. Dr. Carole Lieberman, thank you both so much for lending us your expertise on this segment. We'll keep an eye on his case and see what happens. Very serious charges, and thank goodness no one was hurt.